My mother and wife both had breast cancer. I've had prostate cancer, and my father died from the disease. Is it possible to give a rough estimate of the statistical likelihood of my son developing the condition? He's only 21. Is it worth his while having genetic testing done now?
In terms of genetic testing, that's very easy to answer. He should not be tested because there is no genetic test for prostate cancer predisposition. We know about 100 different genetic variants that we believe are associated with the risk of prostate cancer, and those are currently being tested to be used in clinic, but we don't know yet whether they are useful or not. But I would assume that in 5 to 10 years from now, such tests will be available, and although we know that the prostate cancer tend to arise earlier in those men who have a family background compared to those who don't, still it's very unlikely to have a cancer before the age of 50, so this man has plenty of time to take the genetic test when he's in 30s or 40s.
So this question from this patient is actually very relevant to our patients and the suffering they go through. The suffering is not only physical but also mental anguish and anxiety very often. The first thing I would say is that most prostate cancers are not hereditary, but a small proportion are. And this is particularly a concern for patients that develop prostate cancer at an earlier age with 2 or more relatives with the disease. I would strongly recommend to patients that have this kind of concern to speak to their doctor and ask for referral to a genetics counsellor. And clearly, if the family history does indicate sequencing of the patient's normal, what we call germline DNA, then that will be done. And in particular, there are some genes that we know increase risk of prostate cancer. However, not all inherited genes are currently understood. The BRCA2 gene, for example, and to a lesser extent the BRCA1 gene are the most clearly understood and increase the risk substantially. And that would be a risk not only of prostate cancer, but it would also be a risk for other cancers, for example, breast cancer and ovarian cancer in women in that family.